Traumatic brain injury, the CDC defines it as a disruption in the normal function of the brain that can be caused by a bump, a blow, or a jolt to the head, or any type of penetrating head injury. Top 3 causes of TBI: car accident, firearms, and a fall. Firearms can be a gun in the home, a gun in the neighborhood, a student unfortunately bringing a gun to school, or even sports where firearms are used. And a fall, students, they fall all the time. They can fall out of bed, fall down the stairs, fall off their bike, fall during a sport, fall on the trampoline. But any type of fall that leads to a blow to the head that disrupts the function of the brain causes a TBI. And those are the top 3: car accident, firearm, or fall. Additional causes of TBI are any type of open head injury, closed head injury, high-speed injury, chemicals or toxins. This could be a reaction to a drug, prescription or non-prescription. Hypoxia, anything that leads to oxygen deprivation. Stroke, tumors, infections, with all of the germs that the students are around daily. Cuts that they may get or scrapes can lead to an infection, and that infection can lead to a TBI. Effects on learning. So it's a progressive recovery progress. That means they are going to take small steps, a little at a time, and slowly see their progress as they head towards recovery. Their physical and mental endurances may be limited. What they could do before in the classroom, they may not be capable of doing when they return to your classroom. They're physical. They may not be able to walk. They may not be able to sit for long periods of time. Sometimes they may not be able to communicate verbally either. So additional time will be required to relearn concepts, regain the skills that may have been lost from the TBI before they can continue with the classwork in your classroom. Some issues upon returning to the classroom: sensitivity to overstimulation. They may become agitated or aggressive, disinhibition, emotional lability. This means they may have mood swings. So some of the classroom interventions that you could put into play to help your student along: a quiet and simplified atmosphere where the noise and the activity levels are kept at a minimum. You may need to get the other students in the classroom involved and let them know that things are going to be a little different while the student is recovering. Sensory stimulation kept at a minimum. Again, noise, light, movement. They have these light covers. You may be able, if you don't have them in your classroom already, you may be able to borrow them from your special education department, or the child study team may be able to get those for you. Seating near a teacher or helper peer. This is important so that they don't need to get up if they need help. Also, if they're feeling a little overstimulated, they can just have someone nearby to speak to and let them know that they're feeling this way. Providing a study corral. Right here, if you have this type of desk available to you, this will help block out any visual stimulation. It will muffle the noise. If not, you can always use the dividers as an option as well. So also removing extra materials, pencils, books, papers. In the picture that you just saw of that desk, it was free of everything except for the laptop. Good idea to do that so that you don't overstimulate the student. Dividing work tasks into smaller sections. Just modifying how much work you're giving the student. Make sure they have ample time to rest in between. Headphones, for those times when you can't keep the rest of the class quiet, headphones may be necessary to reduce that external noise. And a designated space to rest or take a timeout, either in your classroom or maybe set something up with the school nurse where the student may be brought down to the nurse so that they can quietly rest there. Additional classroom interventions, the length of their school day. They may not be able to make it through a full school day, so maybe they'll only be coming in for a partial day, either in the morning or the afternoon, and you'll need to plan the activities and the scheduling appropriately. Nutritional needs, they are recovering, they may require additional fluids, additional nutrition, which their doctor will relay to the school nurse, and then you need to make sure that you're aware of what those needs are. Written or picture checklists. So instead of, you can have visual cue cards with pictures that the student can point to, or you can simply show the student without speaking. And transition times and out of classroom activities should be pre-planned and structured. Maybe the student's not going to be participating in their specials, in gym class, or going to the cafeteria to eat their lunch because of the amount of noise and stimulation there. So you'll need to work on their activity schedule, make sure everything is pre-planned, structured, and that you have something in play for transitioning from one activity to the other. According to the article, this was a very important typical classroom accommodation, and it was to provide external devices and cues that the student can use to compensate for organization, memory, and motor deficits that were caused or may have been caused by the TBI. Also, for some typical classroom accommodations, assistive devices, recording devices, calculators, electronic spellers, laptop, tablets, some augmentative communication devices if they are not able to speak, something so that they can communicate with you, timers so that you're making sure you're giving ample rests and breaks, you're not giving too much work over long periods of time. Remember, their endurance may not be up to what it was before. Alarms. Now, when I read this, I automatically thought loud, blaring alarms. It's not. It's a way for the student to alarm you that they're feeling overstimulated, that they can't go on. And it can be as simple as a picture card, maybe green on one side, red on the other. You may even have a yellow that the student can just place on the desk next to them. Green, I'm good to go. Yellow, I'm feeling a little not sure. And red, I can't do this right now. And then some of the students with TBIs may require some type of wheelchair, walker, electric scooter if their mobility has been affected. Also, labeling items in the classroom that they may be using. They may be confused as to what the items are called or the areas in the room are called. So labels, maps of where they can find the items in the classroom and in the school. Very simplified map of the school that basically just has the places that they'll visit. The nurse's office, the bathroom, your classroom, the exit and entrance to the school. Checklist, pictures, which I already spoke about, just having some pictures for them to place for you so that they don't have to verbally communicate. Post-it notes so that they can put a note on an item or near an item. Maybe if you're assessing them, they could just place a post-it note on what their choice for the answer is. Calendars, planners, and journals. This is really good to show their progress so the student can see their progress. You as the teacher can see the progress. You can share that with the child study team, the student's parent, and then maybe the parent will go ahead and share that with the doctor so that they can see how the child is or isn't progressing. Some additional classroom accommodations, pre-printed notes instead of having, depending on what age level, having the student take down notes. Pre-printed, you can give them a highlighter, they can highlight key points in the notes. Large print books so that they don't have any eye strain, or audio books at a very low volume. And graphic organizers, allowing more time on testing, reducing the amount of written work required. Giving assessments in multiple choice formats so that the student doesn't have to write, they can simply highlight or circle their answer, and giving pass-fail grades rather than a letter grade at this time while they're recovering. In the article, it said that teaching strategies that are effective with students with learning disabilities also may prove useful for students with a brain injury. So in the article, they do suggest using the direct instruction, the DI model, that this may be helpful for students with TBIs as well. And this is just a quick recap of what the DI model is. Select a meaningful goal or skill the student will need to learn and present it at the level of the student. Provide a simple rationale to help the student understand the relevance of the skill that's being taught. Give clearly stated task directions. Limit the number of steps. Very simplified. It could be simplified one-word tasks or picture tasks. And ask the student to repeat or paraphrase the direction to ensure they understand. They might be feeling a little unsure at this time, so let them reassure you that they know or they don't know what's expected of them. Break the tasks into small steps and demonstrate each step. Provide opportunities for student response and practice at an appropriate pace. We don't want to rush anything along. Provide immediate feedback and error correction when necessary. Feedback should be positive. And use verbal praise and encouragement frequently. Again, they're going to be feeling unsure. Some of the students may be scared, not really understanding what's going on with their brain function, and giving them that reassurance will really help them to learn and to get through the progress of their rehabilitation easier. If you have any more questions about TBIs, traumatic brain injuries, I hope you found my presentation useful. Here's the references, a link to the article, and the CDC's website has a lot of useful information as well. Thank you.